Good morning, Virginia. This is Virginia This Morning.
Well, good morning. Welcome back. As we age, we are often faced with long-term care questions and options. Our Jessica Knowles sits down with award-winning, nationally recognized geriatric care manager, Dr. Marion Summers. Here's the conversation.
You may be considering long-term care for yourself or for aging parents, but it can be expensive, and waiting to start can also limit options. Elder care expert Dr. Marion Summers brings tips to properly plan for long-term care. Good morning, Dr. Marion. How are you?
Thank you. I'm fine. Thank you for inviting me.
It's our pleasure. You bring a very important topic to the table that a lot of people have heard about, but may not necessarily know what to do with. Is that what you find often?
Absolutely. That's why we're taking a 9-week tour around the country, starting in New York, going down the whole coast, across the country, and then over to California and ending there. In that 9 weeks, I'm hoping to interview people, congressmen, people in the government, anywhere we can, speak to someone, the man and woman on the street. People do not know what to do, and they usually don't do any research until a problem actually happens, and by then it's too late. They get so overwhelmed with the incident at hand. So research is what they need to do and get themselves informed as early as possible before there is a need.
It's important to start that research. Where do you start with that?
Well, I try to have people understand that they should know what's in their neighborhood. First, they need to, I use the word care, C-A-R-E. Consider your own health needs. You know, what's your history and what's your family history, and kind of understand and take that into consideration. And if you need to change some of your habits, change them now. Assess the situation, you know, assess everything that's going on. Then you go on to research, understand what's available in your immediate neighborhood if you're thinking about a nursing home or assisted living or any of those facilities, and understand that most insurance and Medicare is not going to cover that. So people have to start thinking about it for themselves. And R is for research. Research the cost of all of these things. So education and research, but the thing is to start now. I want people to be not to be reactive, but to be active.
Be proactive in that research and in understanding, and that's half the battle. Because you do think, well, surely there will be money in place that's going to take care of this, but often do you find people don't understand exactly how much is going to be needed? Well,
that's why I ask research. Find out what the cost is in your immediate neighborhood or in your state or town, and then 3 and 4 has a website that you can calculate. There's an actual calculator, and it will tell you what it costs, and say you want to move to another state to be closer to your children. Then you just calculate what the cost would be in that state as opposed to where you are now. So there are resources out there. There's also long-term care insurance. People need to understand that when you get long-term care insurance, you can get it the earlier you get it in your life, and the healthier you are, the lower the costs are going to be. And there's also something like reverse mortgages, that if you have a house that has equity in the house, you can pull out the equity with the reverse mortgage. If you're over 62 and you have specific needs, you can pull out that equity, and that money is not taxed. That's a very important aspect. It's not going to affect your Medicare if you're on any of the social services. So those are the things that people need to know. But the thing is, they have to research it now. We also have a contest, a $50,000 makeover contest, because we know that elder care and the issues around that are so important and can be devastating to a family. The $50,000 is a makeover for that individual and its products and services, and we will go in, assess the situation, and whatever the family needs to get themselves back on their feet and to help change the living status of the house. There are all kinds of things that can be done, but people don't know what to do. But they have to enter the contest. One person will win, and it will make an enormous change on somebody's life.
Absolutely, and a makeover like that at $50,000 could certainly help quite a bit, so you want to make sure that folks take advantage of that. Thank you for this great information. We appreciate you coming through, and good luck on the next few weeks of the tour.
Oh, it's my pleasure to be here. Thank you very much for inviting me.
Absolutely. You can learn more and visit our website at WTVR.com/VTM. And now we're going to send it over to you.